We spoke to opposition health spokesman Jeremy Rockliff in Launceston yesterday before he travelled interstate. Jeremy Rockliff, thanks for joining us. These latest documents reveal there will be cuts to frontline services now, which will mean, and also reveal that means there'll be more people turning up in hospitals. Now, you've been touring a number of hospitals. What are they telling you about their ability to cope now, let alone if there are more cuts?
Well, what quite clearly they're telling us is that they are struggling with the existing demand under existing resources. Now, that demand is forced to increase by the government's own budget papers, in fact. And so with increasing demand across the health sector, both in rural and regional hospitals and, of course, our major hospitals, such as the Royal Hobart Hospital and the LGH, with less resources, particularly at the front line, they simply won't cope.
Savings do have to be found, though, don't they? I mean, otherwise, according to the budget figures, according to Treasury, Tasmania will be $4 billion in the red in 4 years' time. Isn't it better to make those hard decisions now rather than have harder decisions to be made in a couple of years?
Well, why weren't these so-called hard decisions made 3 or 4 years ago when it was quite clear that there was massive overruns in public service expenditure? For example, the state government overspent to the tune of $1 billion over the course of the last 6 years. Blind Freddie could tell you in a constricting economy, of course, GST receipts would go down. I mean, there was warning signs way before this budget.
Where was health in the Liberals' alternative budget? I mean, in your budget at the bottom, you said saving strategies that have not been removed or reprofiled have been retained. So how many of the government's saving strategies, in fact, in health, would in fact be kept by the Liberals?
We have a particular policy called strategic position management, which highlights the fact, of course, that, and by the Treasury's own figures, the Treasurer's own figures, 1,300 people leave our public sector over the course of 1 year through natural attrition. Some may retire, some may get jobs in the private sector, some may move to the mainland. Now,
but that's not strategic. With respect, Jeremy Rockliff, that's not strategic, is it? Waiting on people to leave.
Yes, it is if you manage it the way that we plan to manage it, because 900 of those people are frontline staff across the public service. We would retain those positions. Over 400 of those people, of course, are middle to upper management, not essential to frontline service delivery. Now, the targets of 1,700 jobs in the public sector over 4 years can be managed strategically by our policy of strategic position management of 425 jobs a year over 4 years. Those jobs are not essential to frontline service delivery.
Health Minister Michelle O'Byrne has never ruled out job losses, and has simply said these cuts have to be made in order to meet the budget requirements. That, you know, it's just you've got to spend within your limits. Doesn't she have a point?
Well, she does not have a point when quite clearly she's not upfront about where these jobs are going to come from, and the only information we are provided with is those documents that are being leaked internally from the Health Department. Quite clearly, we can demonstrate the fact that when it comes to savings, taking 90% of those savings measures from frontline health service delivery, our ambulance services, our rural and regional hospitals, our major hospitals, of course, is not the way to go. Rather, there should be savings made in the areas that I've just suggested. $15 million is being spent in a policy unit, of course. No policy has come forth with respect to how to properly manage this, for example. And those areas in middle and upper management have to wear the brunt of these health-saving measures so we can protect our frontline services and deliver an effective health service now and into the future.
Jeremy Rockliff, we're out of time. Thank you.
Thank you, Ellie.